Okay.
Okay, if you can make me co-host, then I'll be good.
Yeah. Is that captioning showing up on the?
I'll tell you in a sec.
All right, thanks.
Yep,
Great.
that was quick.
All right. Thank you. Yep. Good afternoon. For those of you who have just joined us, we are live streaming, and I am going to just start the record. We'll get started in just a minute. We're just waiting on a few folks, so hang tight. Thank you. Okay, good afternoon. Welcome. This is the BRFSS work group of the Alzheimer's Disease and Related Disorders Commission. I'll go ahead and start the housekeeping, but just for everybody who's joined us, unfortunately, Carol Manning is unable, well, she may be able to pop on for a little bit, but she's had a family emergency, and definitely, she said she would not be able to join us for the whole time. So hopefully she'll be able to join us for a little bit. But in lieu of her being here, I'll go ahead and kind of direct the meeting. But given our topic, I would hope that the members really help move this forward. So without further ado, I'll go ahead and do the housekeeping, and then I'll pull up the agenda. Hang on just a second. So due to the active state of emergency, this is an electronic meeting pursuant to item 4-0.01 of the 2020 Appropriation Act. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted via a roll call of voting members. Meeting materials are posted under the Alzheimer's Disease and Related Disorders Commission's Workgroup meeting tab at the link posted on the slide. Members of the public are able to live stream this meeting via the DAR's YouTube page. Please be advised that if the live stream is interrupted, we will need to pause the meeting until it is restored. Public comment will be accepted by email or phone to my attention. Public comments that were received by by April 5th today will be read, or if lengthy, summarized during the meeting when we reach that agenda item. I am going to skip the Zoom functions unless anyone would particularly like me to talk about them. No, okay. Just a reminder that if you have meeting-related business, please don't put it in chat because chat's not available to the public. But if you have some technical issues, please feel free to use the chat. There won't be any votes today, so well, we will have a vote to approve the agenda, so that will be a roll call vote. Please, you'll be asked to indicate your support with an aye or a yes, your opposition with a nay or a no, or abstain. I'd like to thank the DARS video teleconferencing team and the communication team for making this electronic meeting possible. So I'll do a roll call of members to confirm attendance. Carol Manning is not here. Lana Sargent.
Here.
Isham Williams.
Here.
Laura Bowser.
Here.
Trevania Brown Hughes. Kim Kuttner.
Present.
And Carter Harrison and Pam Teester sent their regrets. So, okay, let's just pull up the agenda. And everybody see that okay? All right, so we'll go ahead and do welcomes and introductions. So thank you all for coming to the second meeting of the BRFSS work group. As you know, this work group is tasked with developing a publication analyzing the 2019 BRFSS behavioral risk factor surveillance system surveys, cognitive decline, and caregiver modules, which we asked also in 2015. And I really appreciate everybody coming. If you'd like to, so I'm George Worthington. I'm the Dementia Services Coordinator with the Department for Aging and Rehabilitative Services and staff to the Commission. If I'll just call on people in the same order I did the first roll call. If you'd just like to introduce yourself briefly, that would be great. Thank you. Lana Sargent.
Hi, everyone. Just briefly, I'm Lana Sargent. I'm a Vice Chair of the Commission. I'm an Assistant Professor at VCU School of Nursing, and I'm happy to be here with you all.
Thanks. Sean Williams.
Hi, everyone. This is actually my first meeting to this group, so I'm looking forward to hearing what you all have done already. But I'm an Associate Professor at the University of Virginia in the School of Nursing.
Thanks. Laura Bowser.
I'm Laura Bowser. I'm chair of the commission, and what brings me to Alzheimer's is a personal connection. My mother passed away with early onset in 2017, and I am an HR consultant.
Thanks. And Kim Kuttner.
Hi, I'm Kim Kuttner, and representing Riverside Center for Excellence in Aging and Lifelong Health.
Thanks. Okay, so we'll go ahead and adopt the agenda unless anybody has, as presented, does anybody have any changes to the agenda? Okay, would somebody like to make a motion to?
I'll motion.
I'll second.
Sorry, who was that?
Laura, and I think Lana.
Lana, yeah, I'll second.
Okay, thanks. So I'll do a roll call. For those in favor of adopting the agenda as presented, please say aye or yes. Lana Sargent.
Aye.
Isham Williams.
Aye.
Laura Bowser.
Aye.
Kim Kuttner.
Aye.
Okay, the agenda is adopted as presented. Thank you. So there was no public comment received, so we'll move into the next section, which is the open discussion. So I just wanted to ask if I'll give a kind of brief introduction and overview of what we did at our last meeting. I did send out the minutes, so hopefully those of you who weren't at that meeting were able to read the minutes and get a sense of what we did do in that meeting. But really, we went over the basic cognitive decline and caregiver module results. We had a quick look at some of the demographics and then discussed various avenues for analysis and possible questions to ask of the data for the publication. At the kind of tail end of the work of the meeting, Dr. Manning asked everybody if they'd be able to watch the 4 webinars that the CDC presented on those 2 modules and the BRFSS itself. So were folks able to view those webinars? I see some nods.
Yes.
I was, George, but I do not, I just checked my email again. I did not receive the minutes from the last meeting. Can I get, I know I wasn't on the original email, so that could have been why, but I neglected to ask you for that ahead of time.
No, it's my fault. Did everybody else get the minutes? Maybe I didn't send them out. I'll just go ahead and resend them now. Bear with me a second. Actually, I'll do it once we start the discussion. And I've got a second to concentrate. So, so yes, so folks were able to see the webinars. Were those useful? Did you find that helped explain the modules and the survey well enough to give you a feeling like you understand it and are prepared to move forward on asking the data as something useful?
So I watched, there were actually quite a few, but I watched the introduction to the behavioral risk factor. So the BRFSS data, the cognitive decline in caregiving, and I wrote down more questions. So, but I found it helpful. I think there's some more in there that I'd like to watch. They just need more time to take a look at. But I liked that one. That one was done by Dr. McGuire. So I'm not sure if everyone viewed the same one, but that was the one that I looked at, and it was helpful for the overview, but it also brought up just sort of additional questions that I think are worth discussing too here.
Okay.
So if anybody else saw any other ones that were in there. I tried to focus on the one specific to the the outcomes that we were looking at, which was the cognitive decline in caregiving.
Yeah, that's the one I also watched. And I honestly have more questions now than I did before I viewed it. So I'm interested to hear what everyone else has to say.
I'm going to put, oh, I can't use the chat. Sorry, I'm so used to working in other meetings. I was going to put the link in the chat for other people to access it, but.
You can put the link in, that's fine.
Okay. If anybody was looking for the exact one that Laura and I were talking about.
I think George also sent them to us in an email. So I just clicked on it again because I actually didn't, since I didn't know what outcomes you all were interested in from before, I apologize. I just kind of looked from the beginning just to kind of refresh my memory about what the BRFSS was. And I've used, at least I know a lot about it, but I just wanted to get a sense of it. But I agree with you, Lana. I feel like I need more time to look through the rest of them. And I'm not sure how much I can contribute to the conversation, not having, maybe hearing your questions and think about that as we move forward. But I did not look at the one that you all have looked at already.
Okay, so Dr. Manning's just joined us. Hi,
Hi.
Carol. So we were just discussing what webinars people had watched, and we've adopted the agenda, so we're just starting that discussion.
Great, thank you, and I apologize for being late. Okay, so the agenda's been approved,
Yes,
and
there was no public comment.
okay. And you were saying, how many people actually had a chance to look at the webinars?
Hello, everyone. Welcome to the.
That was me. I apologize. Your video, when I clicked the link, it just started playing. So I just wanted to look at the one she said that they watched.
Yeah, I think it's the same one.
I'll mute myself so that doesn't happen again.
Oh, no worries. Carol, we were just talking about how we watched it and then had more questions that we brought to the group.
Okay. I
And we wanted to bring to the
don't
group.
know if everyone, it's funny, I'm actually with my mother here in her hospital room, and I'm trying to get my headphones to work so that she does not have to listen to. Hold on. I might get my headphones to work. All right, try again. Lonnie, can you say something?
Can you hear me?
Yeah, but I hear you still through my computer. Hold on.
Yeah, try your Wi-Fi, the Bluetooth function at the top.
Yeah, it's
Does it say your AirPods?
it says
It is the
AirPods
same
connected.
Thing.
AirPods connected. Done. Any other suggestions, anyone?
Maybe if it says it's connected, disconnect them and connect them again.
Like that, but I'll try it again.
If anybody else has any other
Your
ideas.
audio settings.
Right,
Your
yeah.
audio settings on the microphone down. And sometimes just that click changing the system will allow you to get back to your.
Not
Actually, I had that too. Sometimes it's in Zoom. So if you go to your Zoom, so it might be connected on your computer, but if you go to Zoom, I think the audio settings, like Ashan is saying, somewhere in there.
Hold on. Okay, so
I think. Go Zoom preferences.
so now it's not. Okay, now all right.
Audio, and then it'll say test speakers, and make sure your AirPods are selected.
So you're up at the top where it says Zoom.
You point at .us, go to zoom.us preferences, click on preferences, and you'll see settings pop up, and audio will be the first one.
Screen, audio.
And then in the drop down, it should say like Carol Manning's AirPods
Audio.
or whatever you name them. If it says internal speakers, then it's probably set to your computer.
This one. Okay. Try now.
She's muted. She's muted.
So I still hear you. So I'm now. All right. Never mind. We can.
Can you hear us on your ear?
I can hear you fine. I just was. Yeah.
Can you hear us on your AirPods? No.
We're still in her room, not on her AirPods. You can leave and join again. And before you join again, Carol, you can just set up your audio settings, like test your speaker and.
Okay, so I'm going to leave and try again. I'm sorry to disrupt everything, but I'll just try that and then I'll come back in. If George will let me back in. Okay, I'm going to try.
Bye. Sometimes that's just easier, just to leave and come back.
That's a good suggestion.
So the link that I sent off with the video, there were also slides associated with it too, just so people know. Like with each webinar, there was a slide set, which was nice, of the data that you can download or other presentation.
Yeah, I think some of these slides are in the other ones too, because I think that's why I looked at one of the overall. So I'm just curious, maybe we'll wait till Carol gets here, like what questions were generated. Maybe she can, we can start there. And George, thank you. I did get the minutes. I just saw your email come through.
Right, okay. Yeah, and I'll just put the link into, that was for all 4 webinars, and the slides I think you could access from that link.
Okay.
Can you hear me? And you're
That works.
Yeah. We're just gonna go pieces.
well. Thanks for joining us.
Yeah.
A caregiver yourself.
So Lana, you were saying there, or someone was saying there are more questions from watching the webinars?
Yeah, we were just saying we watched them, and it kind of just brought up, more ideas or more questions.
So I found it actually better to actually look at the website, and that was more helpful to me. And then I actually looked at the caregiver questions, which to me was the most helpful thing. And I'm going to put that in the chat if for those of you who may or may not have looked at the actual questions.
That would be helpful.
Would you like me to share those, Carol?
Yeah, actually, if you
Screen?
can share your screen, that would be great. That would be great, George.
Okay. So that's the cognitive decline questions. Do you want the caregiver module first or the cognitive decline?
I think so what I was most interested in was the caregiver module, but either one. Are you at cognitive decline is fine. Oh. Doesn't matter.
Sorry. No, I think they're all in one file. So yeah, here we go. So do you want me to just run through these quickly?
Sure. And Lana,
Okay,
if you were running the meeting at this point, you go right ahead.
Wait, what's that?
If you were, whoever was running the meeting before I got on, just go right ahead. And
George was.
Okay, go for it, George.
Okay, so the screening question for caregivers is: during the past 30 days, did you provide regular care or assistance to a friend or family member who has a health problem or disability? So just remember that's 30 days. People who are no or don't know, they move on to the next section. They don't get asked any other questions from this. The next question asks about the relationship, and you can see there's a whole long list of different kinship relationships and also non-relative or family friends. And if somebody's a little unsure, they can cue them by saying, refer to the person to whom you are giving the most care. And as Carter Harrison said last meeting, they don't provide any other information. The surveyor, apart from what's in these questions, they'll just continue asking it until they get a response that they can act on. Then they ask for how long have you provided care, so less than 30 days, 1 month to 6 months, 6 months to 2 years, 2 years to 5 years, more than 5 years. So there might be something in there related to length of caregiving for people with subjective cognitive decline or with dementia. The fourth question is, in an average week, how many hours do you provide care or assistance? So it breaks it down, 40 hours or more is the longest. And what is the main health problem, long-term illness or disability that the person you care for has? So again, they get a long list of conditions if they don't spontaneously pick something. So if they say that the main condition is Alzheimer's disease, they skip the next question. The next question is, does the person you care for also have Alzheimer's disease? So they're looking for comorbid conditions with dementia. And there's two ways of getting at that. One is directly from the care. Well, there's only one way of getting at that. And then lastly, the next question is, in the past 30 days, did you provide care? What sort of care did you provide? As in ADLs, such as giving medications, feeding, dressing, or bathing. And then the next question is other tasks such as cleaning or managing money or preparing meals. And the last question is, in the next 2 years, do you expect to provide care or assistance to a family member? So, sorry, if they answered no or don't know to the first question, they get sent to this question, and then they move on to the next module. So everybody is asked this question as well.
It's actually not very many questions. And if you look in the chat, I put the CDC's kind of little brochure module about it, which I thought was really helpful in terms of understanding the data they collected. George, do you mind sharing that as well, please?
Yep, so what would you like to look at in there?
If you'd go a couple pages in, it describes what the data they've collected and actually how they did it.
So this the history or?
Right. History.
Okay.
You can just kind of flip through.
Okay.
So this is nice. Do they have one for the other modules too? Like the two that we were looking at were cognition and caregiving. So do they have one for their cognition one too?
I would assume, I didn't look at that one, but this of everything, this gave me the best idea of
I agree.
what they had.
Yeah, this is nice.
Also tells you how, depending whether you're using SAS or Stata, how to find it.
Oh, the code, right. Did you find this on the CDC site or in the modules?
I honestly have no recollection of how I found it. I just was poking around.
Yeah. a good find.
So I can email these. I've got copies of these.
Okay.
So yeah, it goes question by question. And then at the end, it's just references. They do give a range of publications that have used this data.
Yeah, I guess that was one of the questions that came up to me is just to make sure that we are building off of maybe things that had already been done. I wondered if someone maybe, or something that might help us guide what we're doing is what publications have been done in this area already on the BRFSS data so that we're either not replicating or maybe we're building off of it. Because I don't know what other.
Yeah, so I looked through some of these and then I thought about things that we could look at just in Virginia data and then compare Virginia data either to the nation overall or to nearby states or different states. And I'll just read off some of the ideas that I had about this. And after communicating with George, these data, they're just completely readily available. So we could decide to look at this tomorrow. And I actually have a postdoctoral fellow who would be happy to help look at any of these things. But these are just some ideas off the top of my head. So I was thinking we could look at caregiver responsibilities, things like hours per week kind of care, in relation to caregiver age, health status, healthcare access, subjective memory of the caregiver versus the condition of the person they're caring for, look at chronic conditions, demographics, including race, education, marital status, income, diet, as proxy for social determinants of health, look at caregiver depression or poor mental health in the modules that look, there's not a whole lot on mental health. There are two questions. There is a, how is your mental health? And there is, are you depressed or not? So there's not a whole lot there, but that does give a subjective sense of what the caregiver, how the caregiver rates themselves. And then we could compare to either to non-caregivers or to caregivers of people without dementia. So look at another chronic condition and look at differences in things related to caregiver responsibility, health status or healthcare access of the caregiver, all of those things. So those are just ideas off the top of my head. And I think those are all very doable things. I don't know what other people are thinking or if any, did anyone come into this with particular ideas on what they would like to look at?
I can start. Since I wasn't here, I feel like I wanted to hear what you all were interested in, but of course my own personal interest, similar to you, Carol, I was really interested in the subjective memory with care, like from if we can find anything about that with the caregivers, as well as looking at quality of life, which I didn't hear you mention, but if there was any measurement around the quality of life with these caregivers or some, you know, some way of including that piece. I love your ideas about social determinants of health, of finding items in the data set that could be proxies for looking at social determinants of health, while we look at some of the within group differences as well with race and ethnicity. So that was what I wanted to add.
So thanks, Ashan. And you know, those are things that I'm really interested in also. In terms of quality of life, there is not to my knowledge, there's not a quality of life item, certainly in the caregiver module, and I don't know about any of the other modules. I had to look for those two, the depression and mental health items. George, do you know if there's a quality of life item somewhere?
I don't think so. Yeah, I mean, it's really looking at healthcare risks. There were more questions about specific conditions, and then chronic conditions, and
Well, I would think we could also then, I looked at some of the other modules too, Carol, and I didn't see anything, but I was like, maybe I'm missing like what they would title well-being as terms of like not self-rated health necessarily, but something around the impact of this on like the impact of these risks on one's health. But also looking at the number of comorbidities, I wanted to make sure we looked at that. I like your idea of comparing those who have dementia with those who don't, necessarily not just caregivers versus non-caregivers, but those who have caregiving responsibilities with someone who has dementia in addition to other comorbidities. So I think that that's a new, or at least that's been something in the evidence we've seen has been a really important thing to consider, the number of chronic conditions people are managing in addition to dementia.
Along those lines, we could look at, so you're saying number of chronic conditions, dementia among them, or dementia versus one other, I mean, we could look at one other chronic condition, or, I mean, sometimes people do not put dementia as the first condition in terms of why they're caring for that person.
Right. I think we would have to look at all of those, like probably do some cross tabs to see where folks are putting them, and then see, is it those with dementia plus additional comorbidities, or if we want to say dementia and additional comorbidities. So I think we would have to look at and see how the data is falling out to be able to say what's a meaningful, exploration between groups, right? Like that's, and I don't know. I just know that the number of comorbidities is, we probably, when I think about disparities, when I think about equity, and I think about how many chronic conditions people are managing and that impact on the caregiver.
We also don't know how many people they're caring for, which is too bad, because that would be that would be good information to have.
I like all the ideas. We talked about these last time too, and I like where you're going as far as looking at differences for caregivers who are taking care of someone who has cognitive issues or Alzheimer's versus maybe factors that may be different versus someone who's taking care of someone with vascular or diabetes, but not listed any of those being dementia or memory related. One of the things that stood out to me in the data that was shown, I don't know if Sean has seen that, but I know George showed us some data that I thought was really interesting that I would like to explore a little bit more, is the caregivers were reporting a significant amount of subjective cognitive decline themselves, but were not reporting it out to anybody. And so there was this disparity. I also think there was probably some health equity issues around gender and that might be really interesting to explore. And I know that was on your list, Carol, but I think women tend to be more, caregiver for more people. And it is too bad that we don't have the numbers of people they're caring for, but there may be some health equity issues around women's health in there. It might be interesting to explore. But I was particularly interested in the fact that caregivers are reporting such a high level of subjective memory decline, but we're not telling anybody that the rate had also gone down in their reporting. And maybe we can't do anything. I don't know if we have some ideas, we can brainstorm about how we can explore that a little bit. And maybe we can't with the data we have, but just to report it as is. But it would be kind of interesting to explore why they wouldn't be reporting that out. I'm just really interested in that part. That's the only piece I'd add.
Can I just clarify something? So Lana, we don't actually know yet because we haven't done any analysis on it. The data I showed you last meeting was for each module separately. So within that subjective cognitive decline module, half of the people that reported that they had subjective cognitive decline had not spoken to a healthcare professional. And then separately, there was the caregiver module. So we don't yet know how many of those people answering yes to being a caregiver also experience subjective cognitive decline. But I think that would be an interesting.
Yeah, if we could put that in to explore it, I think that would be interesting. Just that piece to explore that, really.
You could also see how many of those caregivers had reported to it, had spoken with the doctor versus how many had not, right? And see whether that was different for the overall population of people reporting subjective cognitive decline. So are the caregivers with cognitive decline behaving differently to the general population with cognitive decline?
So to make sure I understand, we will be able to determine which caregivers also reported subjective decline, and of those who reported subjective decline, how many of them also reported it out to somebody?
Yeah, it's just that the data he showed us was sort of a global picture, but we can tease it out. We can look specifically at caregivers, their subjective decline, and how many of them have reported out, which I think would be interesting to take that extra step to just look at our subgroup.
I agree completely. So there are a lot of people on the call we have not heard from, and I'm curious to hear your ideas on what you would be interested in looking at. Anybody else? Laura?
So for me, I agree with what everyone's saying. Where I was most confused is how other states are using the data. I'd really like to see what that looks like and how we can kind of benchmark Virginia as a whole.
Anybody else?
I think last time Carter also mentioned that he wanted to have data that he could use to leverage with policy.
So I have a quick question.
Yeah.
Go ahead, George. Go ahead.
I was just going to, so yes, Carter did mention that it would be great to have some sort of question or approach that would support or help clarify or shed light on some of the recommendations of the Dementia State Plan. But I think that the direction we're heading is, or at least the questions that have been raised today are interesting. And the data itself, so that kind of global overview of the cognitive decline and caregiving modules can provide some, I guess, understanding of the issues that can and quantify some of those issues that can then be used to support the plan generally. So I think as long as there's a good general introduction of the data and maybe some link to the state plan, but the state plan talks about this data as informing, our understanding of needs and the situation on the ground. And so I think pretty much anything we do is going to help support the plan. I don't think that we need to really think about tying it too specifically to any one goal or recommendation.
So if we started by just looking at the demographics of the data, of the caregiver data within the Commonwealth of Virginia, it seems like that's actually a paper right there. And then I'm hearing two other papers. One is social determinants of health, and we need to figure out exactly I mean, that could be, we could look at that several different ways. And then there's the, what Lana was talking about, the subjective cognitive decline, and whether or not people actually let anyone know about that is a third paper. Does that, yeah,
It could be. One of the thoughts might be to start, like you said, Carol, with the demographics. Like, let's just run the variables that we said. I'm going to approach this from a very academic standpoint. Like, let's just run it from, like, look at all the variables and then even come back and set some specific aims, or like we might have two, like you said, two big aims that we want to look at, and those become the two papers or something to that approach. If people have suggestions on our approach, I thought by just kind of taking your variables and running them and tabling them, like let's look at gender, let's look at all the demographics, let's potentially pull, I took a list.
And so Lana, you're talking about the demographics of the caregivers in particular.
Mm-hmm. Yeah. And then look at the maybe even look at, the subjective memory of the caregivers, just anything we can pull, right, initially to kind of get a global sense of what the data looks like, and then come back as a group and take a look at that and see if we can ask some more questions of the data around those two things, health equity, or health status, and maybe equity, and then maybe see if we have enough there on the subjective memory decline question too.
So that sounds good to me. Do you want to pull together the demographics, and anyone, or is there anyone in particular who would like to just run the demographics so that we can look at them next time? Nobody's jumping in here.
Say, how about your postdoc?
Yeah.
Leave it to me to give work to delegate somewhere else. But
no, I like Ishan with Ishan.
I almost asked her to this meeting, but I didn't. I wanted to check with you guys first, and I didn't want to overwhelm her. But it does seem like that is a reasonable place to start. I can ask her just to run the demographics, and then so we're talking about. So it is the caregiver module. I need to know exactly what I'm asking her, because so she has to look at the demographics of the caregiver module. She has to look at the responses in the caregiver module, but she also has to look at them with the demographics module, and make sure that she is getting the demographic responses that are matched to the people who indicate that they are caregivers. So she's going to have to figure out how to combine those two modules.
And I think, aren't you just looking at Virginia?
Yeah.
In Virginia. Yeah. So I think that's, yeah.
So it's all one data set, Carol.
Mm-hmm.
It's just a question of using the code book to, get the variables that she's interested in and cross-tabulating them.
George, do you have some, it sounds like you do have more knowledge and facility with the data and how to access it.
So the data set, she can download it from the CDC website.
Okay. All right.
And also,
and I think it's in two different formats, depending on which stats package you're using.
So it's in SAS or state, I think.
And the code book is there with all the, how they're naming all the variables.
The subjective memory question is in the caregiver module, or that's in the cognitive module?
It's in the caregiver module.
Okay, great.
Oh, it's not?
No.
Oh, it's in the slides.
No, it's in the cognitive.
That's interesting.
In the cognitive module. So the caregivers are asked whether they are looking after somebody. They're specifically asked whether the person that they're looking after also has Alzheimer's disease in addition to another chronic condition, or if that's the primary.
George,
they're not asked about.
Do you mind pulling up the questions in the cognitive module so we can just take a quick look at it, please?
Sure. So I was going to suggest one thing that might be interesting as well, in addition to everything else that you've talked about, is looking at specific. So we've got a general understanding of a range of risk factors that are risk factors for dementia, and many of those are asked about at some point in the BRFSS. So I'm wondering whether we can do something looking at the people who are answering yes to subjective cognitive decline and seeing which risk factors they have, and if there's a really high share of the folks answering yes have a particular are scoring yes on a particular risk factor, because that would be an indication of where any intervention from VDH, which we're doing under the BOLD grant, should be directed. You know, if there's particular risk factors that are more prevalent in the Commonwealth.
So where are the risk factors, George?
So, well, I'm thinking of the list from the Lancet. So, obesity, controlling hypertension, early life education, things like that.
And I'm sorry, but which module is that in?
So, they'd be kind of scattered throughout, because there's questions about, there's a couple of questions about, well, there's one question at least about education. There's other questions about hypertension and high cholesterol. There's questions about, I'm not sure if there's questions about hearing loss, but there probably are somewhere. I just haven't looked through the whole thing.
I'm scared to ask, do you know how long the code book is? I'm scared to ask because, but it sounds like, because I don't want us to miss anything, especially if we're doing a broad scope, right? And I want to make sure, because I love that idea, George, about identifying if we're able to connect some of the risk factors, which this data set should be rich in, right? Because it's a risk factor, like it's a surveillance of risk, right? So I like that idea, but I do wonder if we should split up the code book almost, like certain people take, two people take a section and go through the variables and say, okay, highlight these are the ones, because if we do this exhaustively first, we potentially have done a lot of the work as we move on to these other papers and things that we would be interested in. And that way, if your postdoc is available, we get them to set us up with these data sets right now before we even start to ask the questions, because we don't want to fish. We want to make sure that we have all the things that we're really interested in first. So what do you think?
Yeah. So the actual questionnaire, the full questionnaire, which includes all the questions that could potentially be asked. So there's the core questions that are asked of everybody, and then there's about 20 optional modules. There's 31 optional modules, and Virginia only asked, I think, 4 of them last year. And I can't remember which other ones they asked apart from the cognitive decline and caregiving, but we can certainly find out easily. There's 52 pages of those questions, of the core questions. So it's pretty quick to go through. And you could, as somebody marking up those 52 pages could say, right, well, we want question, and they've got all the question numbers that would be used in the data set. So we want question LL02, for example, which is about what kind of residence the person is living in, for example. Anyway, so I'd say it's not too huge a task to go through that questionnaire as a starting point.
So I do not want to ask Shannon, the postdoc, to do that. I feel comfortable asking her to do the caregiver module, the cognitive module, and the demographic. But if someone else would go through and identify the questions from the other modules that we're interested in, I then would feel comfortable asking her to tabulate those as well. So is someone willing to do that?
I'd be happy to.
I can do that.
Yeah.
If somebody wants to check my work.
I mean, I have no problems. I think it's important for some of the variables that we're interested in that more than one person does it, but I'm happy to look over it with you, George. And if somebody else is interested, I think it would be great to.
I'll join you. Thank you.
Thanks. And I guess
Okay.
we just need to know which ones, George, and I feel like you're going to help us identify what those other modules are. But yeah, I think that would be a great first step.
Thank you guys for doing that. I put in the chat if everybody wants it, the PDF for the cognitive module and the caregiving module in the slides, and it has the questions for both. So Carol shared I was able to find both all in one slide set.
Mhm.
So that's what that PDF is. And it may be helpful if we can take a look at the demographic variables and just for Virginia, look at the subject decline module and the caregiving module. And then there's a group of people who actually look at the other variables. If we came back together, then we might be able to say, by looking at just the initial overview, what other variables we want to pull from those other modules in. Is it, risk factors? What other risk factors do we want to look at? And Carol, when you were saying comparing Virginia to other states, I did hear that some of the other states don't. They don't run all the core.
Right. They
Yeah,
don't all the modules.
they don't do all the modules.
So my
we'll
preference
have to
would be
consider
just
that.
think about Virginia for the time being.
I think that's a good start.
Okay, I see George is agreeing. And does anyone think that is not the right approach?
No, I think it will be easier for us to get our hands wrapped around it. We could certainly think about it in the long run, but I think it gets complicated, especially if there's other states are doing some modules and not other modules. So if we, like Sean was saying, we kind of look at the other modules in tandem with the ones that the core ones that we're really interested in, we'll have a better idea of what we're working with before we expand out to other states. There's a lot of value in just looking at our state too. I mean, just understanding the Commonwealth.
So I think that makes sense. I think let's start understanding what we have in Virginia and then move forward from there. So I'm not sure where we are. I can ask Shannon to look at those modules. Do those of you who are looking at the optional questions in the other modules want to look through those first, and then I'll have Shannon do everything at once? Or do you want me to have her go ahead and do the demographics, caregiver, and cognitive modules first, and then you get back to me with your optional?
I think it would probably be easier for her if we did our work first, don't you?
Yes, I do, honestly. So,
yeah.
Okay. So what,
then we could do it all at once.
Completely agree. When do you think you can get that you all can work on that together and get that back to me?
So I'm happy to run through the questionnaire this week and send it out to Kim and Ishan, and they can comment if that works, rather than trying to all get together.
Oh yeah, I agree with that.
So by the 13th, we'll have it back.
Let's see what's.
Sounds like to Carol.
Next Tuesday.
Or the
So,
13th.
I'll try and send it to you guys on Thursday. That'll be my goal, and then if you can get it back to me early next week. So Carol, by the end of next week, you should have that. Does that work for everybody?
Yes, that's a good plan. Like, I mean, it's all gonna, I think so. If you give it to us later this week, by the end of next week, so that gives us about a week to look through it, right? So that's what I'm getting.
Yeah.
Okay. Yeah.
Because of the document, it's a big document, but honestly, we can disregard almost 3/4 of it because we didn't ask those modules in Virginia, or they're not relevant.
Yeah. So I think that'll work. And if so George, then we will be communicating via email based on the first draft that you send us, and then we'll okay. I just want to make sure I know how to give the feedback.
Yeah, I think that'd be easiest.
And then I will wait to hear from you. And once I hear from you, I will work with Shannon, and we will get all the descriptives together. And maybe we should set up a next meeting for our group.
Yeah, that sounds good.
Yes.
The only thing is I actually need to talk to Shannon to see what her schedule is like before I enlist her. So to be fair to her, let's shoot for, so you said you're going to get that back to me around how many weeks? 2 weeks?
End of next week, yeah.
End of next week. And then if we give her 2 weeks or so, let's shoot for 3 or 4 weeks from now. Before a month passes. How's that?
Good.
Like the first week of May, you thinking?
That sounds good. Any chance we could come up with a time now while we're all together? How about 1 o'clock on Tuesday, May 4th?
I can do that.
Is anybody?
Sorry, I can't do that. I've got an in-person training that I'm running.
George, you are such a troublemaker.
In person.
In person, yes.
What is
state
in
police,
person?
The state police dementia awareness training.
That's great.
Awesome.
All right, so.
They never got to
sorry.
stay home and Zoom, so they're used to in person.
Right.
5th, Cinco de Mayo.
No, Carol can't do that.
5th is, I'm in clinic all day. It's a,
Okay.
the 6th at 11, might that work for anyone? That's a Thursday.
I could do that.
I can do
Thursday
that.
works.
Actually, that's not good for me.
Okay.
Is there a different time on the 4th or Monday the 3rd?
George, how long is that training?
Well, be tied up most of the afternoon. It's in Richmond. So the morning I can do, but anytime after
8:30?
12 is tricky.
I cannot do 8:30. I can't do from 8:30 until I could do at 11.
What day are we talking about?
Is
again?
that Monday or
11?
Tuesday? Yeah, what day are
Yeah,
Tuesday, May 4th.
Tuesday.
I could make it happen if that's agreeable to everybody else. It's not.
I could move another meeting for that.
Yeah, I can move another meeting. We're talking about 11, right?
Is 10 o'clock easier for people?
10:30?
That works for me. 10:30 is anyone 10:30 does not work for.
Doesn't work for me, but I might be able to move my meeting around.
Okay, so can we pencil in 10:30 Tuesday, May 4th?
This was a better idea than SurveyMonkey. Thank you.
Okay.
It is.
So now I have to ask Shannon to do this and tell her she's got a deadline. How's that? So
That's good.
Still love you.
I like deadlines. They help. They hold. You got to finish it before that time.
all right.
So we're doing
So
10:30.
I am here with my mother, so I'm going to go visit with my mother and
Best wishes.
yeah, thank you.
Yes.
Mom, they're wishing you best wishes. Thank you. Okay. All right. Thanks, everyone.
Thanks, Carol.
Bye, everyone.
Bye.
Great meeting.
Bye.
Oh, we're leaving. Oh, okay.
Bye.
I'm like, oh, that's everybody. Okay. Sorry. Bye, everyone.
Meeting is adjourned.
Okay.
Bye.
Bye.